I'd like to welcome you on behalf of the organization. We are, as we said, a new organization born by, and the inception of which is born by the frustration of all the changes that are coming about in healthcare. No matter which side of the aisle we sit upon, healthcare affects all of us. And we all, depending on which stage in life we are, it affects us in one personal way. Many of the changes and the frustrations that are experienced by healthcare providers were present and instituted prior to the 2010 Reform Act. And now, many people feel the impact of this Reform Act includes possibilities of impacting it even more. Due to that, there's a palpable frustration amongst professionals everywhere you go about what's going to happen to the good parts of healthcare in the United States. Our organization, our commitment, our mission is to preserve and protect the integrity of the provider-patient relationship. That's what we're about. We think that good parts of American medicine are born from the kind of professionals that exist in the exam room, in the hospitals, in the emergency rooms, from physicians, nurse practitioners, nurses, respiratory therapists, physical therapists, pharmacists. All those people have the opportunity to care and give you the plan of care for you. The unique aspect of our organization is that we partner with all the healthcare professionals that have a license to touch a patient. Secondly, we also partner with the public. The public, our patients. We think that by having that kind of organized structure, we can impact in a better way the policymakers, the legislators that will be making before they have any important decisions. That being said, healthcare obviously is not just medicine, it is business. It affects the economy of the United States. You hear all the candidates talking about jobs, all the candidates talking about economics, all the candidates talking about indebtedness. When you have a medical industrial complex that is approaching 17% of the gross national product, you're talking about a situation that affects us all, not just the healthcare elements. That being said, we like the opportunity to sponsor the opportunity for all of us to hear from candidates for office, and we're going to have Rosemary come up and give you the details on how we're going to structure this presentation. And I again thank you for you. We're going to also give you the opportunity to ask questions of both of you. Thanks very much.
It's on, okay. Well, good evening. My name is Richard Gillmor, and I'm running for Congress, U.S. House of Representatives, the 8th District, which is right here in Indian River County. It's all of Indian River County, all of Brevard County, and just a little slice of Orange. I want to thank the Association of Medical Professionals for hosting this forum, and I want to especially thank whoever's responsible for the questions. They are thought-provoking and very interesting, and they have focused my attention on healthcare for the last 3 or 4 days. So I really appreciate whoever came up with them, and you know who you are. So I'm running for Congress. My history is that I worked for myself for 36 years. Last 14 years was in the health insurance business, serving the needs of self-employed and small business people in South Florida and the Florida Keys. I retired in 2005 and ran for City Council in 2008, was elected mayor, and the rest is history. So that's my story. Thanks again.
My name is Dr. Dave Weldon. I'm a physician. Internal medicine is my field. I'm an Army veteran. I served in the United States Army for 6 years. I moved to Florida in 1987 to go into private practice. And in 1994, I was elected to the United States House of Representatives, and I represented this area for 14 years in the House. Healthcare was one of the big policy issues that drove me in 1994 to start focusing on politics and throwing my hat in the ring for elected office. At that time, it was the Hillary Clinton healthcare plan, which was never enacted into law. I was a supporter of term limits during my term in the U.S. House, and I term limited myself in 2008, and went back to my medical practice. And since returning to my medical practice, as far as I'm concerned, the situation in Washington has become horrible. I was driven to leave my medical practice in 1994 because of $200 billion a year deficits. We now have $1.3 trillion a year deficit. And of course, healthcare is a huge issue, and we're going to be getting into that in a lot of detail. But I will say one of my highest priorities will be to either reform or repeal the Obama healthcare bill. It is called the Affordable Care Act. It adds $1 trillion to deficit spending over the next 10 years. So certainly if you're 18 years old getting out of high school and you're going to be saddled with another $1 trillion worth of deficit spending, it's not necessarily affordable for you, though for those people who will gain access to health care at lower cost, it is a good thing, but I think there are better ways we can do it. Thank you very much.
Thank you so much. I'm Shannon Roberts, and I'm also running for the Congressional District 8 as a Democratic candidate. Like Richard, I want to thank so much the association for enabling us to be here tonight, and also those that created the questions. They were very thought-provoking, gave us a chance to focus on some of the concerns that you have. As far as my background is concerned, I am a retired federal executive. I worked in Washington with the US Departments of Justice, Transportation, NASA headquarters, and then also worked at Kennedy Space Center, where I was a director of workforce and strategic planning. After I retired, I served as city council member in the city of Cape Canaveral, and now I'm serving on several regional planning efforts that are dealing with regional initiatives and local initiatives to help bring opportunities to our district and our local communities. I'm running because I really do believe that we're at a very critical crossroads right now in this nation, and we're either going to go forward or we're going to go backwards. And I believe that the Affordable Health Care Act was a movement in a forward direction. It's one in which we are starting to provide for health care for all. As we know, we have about 45,000 Americans that die each year because they do not have health insurance. Unlike Dr. Weldon, in our recent Congressional Budget Office analysis, it's actually going to provide for a $109 billion reduction in the deficit. So it depends on what numbers that we're looking at, but obviously this is something that I think will be good for us in this forum to discuss a little bit more further and to talk about the benefits of what is to come with healthcare reform and what I believe that we need to do in terms of further steps. Thank you.
Hi, my name is Amber, and I'm going to be representing Congressman Posey tonight. And he's in Washington doing his duties as our elected congressman and has votes tonight in Washington. So here's a statement from Congressman Posey. Thank you for holding this candidate forum this evening. I wish that I could join you, but we do have votes scheduled tonight in Washington. Accountability has been a driving force for me, and I have worked hard to lead by example. I have cut my own office budget, returning over $500,000 to the U.S. Treasury since taking office. And I supported efforts to cut all congressional budgets by 5% last year and 6% this year. I have introduced several bills to reform Congress, including legislation that would eliminate a generous death benefit set aside for the families of members of Congress who pass away during the term of their service. I rejected the 2009 pay increase that was approved before I got to Congress and have helped lead the effort to block any congressional pay raises for 2010, 2011, and 2012. In my 3 years in Washington, I have helped lead the effort for more transparency. We now have a rule requiring at least 72 hours for the public and for Congress to review bills before a House vote can take place. No more pronouncements from the Speaker that you must pass the bill in order to find out what's in it. Obamacare passed under that pronouncement, and it must be repealed so that health care is based on personal responsibility, choice, and individual liberty. These are driving principles. Some people claim I have not reached across the aisle. In fact, the co-sponsors of 4 of my prime bills are Democrats. When we can agree without compromising basic principles, then I do. But I will not compromise important principles when I believe others to be wrong. I was influential in bringing the balanced budget amendment to the House floor for a vote. Unfortunately, we were unable to get the supermajority needed for its passage. The President's own chairman of the Joint Chiefs of Staff said our deficit spending was the greatest national security threat to our nation. We had two choices for fighting the debt: the Ryan budget plan. And so they're telling me to finish, so I'll quickly jump to the end. I've represented you as I would expect you to represent me. Thank you for your vote and thank you for your support. God bless you and God bless America.
Would you vote to repeal the Affordable Care Act of 2010 in its entirety? Yes or no? State your reason.
No. And my reasons are there are some good parts of the bill. I was hoping that something like this would pass bipartisanly, but it didn't happen that way. And I think that it could have been a better bill had it been bipartisan, where the Republicans could have contributed something to it. There are some good parts of the bill. It eliminates pre-existing conditions for limitations of, it also does not, takes off coverage caps. It extends dependent coverage to the age 26, which is not a real big deal here in Florida because I think, if I recall correctly, we could insure students until age 25, if I'm not mistaken. But there are states where at age 18 they have to drop off. So there are some good parts to the bill, and I think that we should keep what's good and just change take care of some of the ones that are the items that we're having problems with. Get rid of those. So I wouldn't throw the baby out with the bathwater.
Next question is actually number 6. Do you agree with Governor Scott's decision not to accept further funding for Medicaid? Yes or no, and state reasons.
Well, the Medicaid expansion funding that was mandated in this bill is a component of the bill that was overturned by the court. I believe that's what you're talking about in the question. That was a significant stealth tax on the states. Now, it was a classic bait and switch. They said the federal government would pick up either the bulk of the cost or most of the cost the first 3 years, but it was going to be a backbreaker. Medicaid is already really hurting the states in terms of making ends meet. So in a state like Florida, it would have required either cuts in education or cuts in other services, or it would have required a tax increase. I think if federal officials in Washington, D.C. want to expand a federal program like Medicaid, then they should fund it, basically. Now, the reason why they're trying to do it this way is Washington is basically broke. Medicaid, the federal component of Medicaid is unsustainable the way it's currently structured, and it represents one component of 3 very large entitlement programs that are completely unsustainable into the future. They are going to bankrupt the country unless they're fundamentally reformed. They include Social Security, Medicare, and Medicaid. Medicare alone ran a budget deficit of over $200 billion in 2011. Almost 50 cents of every dollar paid out under Medicare was a borrowed dollar. And Medicaid is similarly running a tremendous amount of red ink. But now this bill, the Obama healthcare bill, constitutes a very large expansion, and there's really no rational way to explain how we're going to pay for this, short of some sort of massive run-up in taxes.
Thank you. Next question. Do you favor a constitutional amendment mandating a balanced budget except in times of declared wars? Yes or no? Just state your reason.
No, I don't. I don't believe that we need to have a constitutional amendment as it relates to that. I personally advocate an opportunity for, this is one with the attorneys, is that correct? I'm just trying to make sure, what number is it? The question, I'm sorry.
15.
Okay. I just want to make sure. Oh, it is, I know, but I want to make sure I'm looking at the right one. No, I don't. In terms of a balanced budget, no, I don't, because I really believe that we need to have a country that provides for both reducing the deficit as well as investments in where we're going. And if you don't do one without the other, I believe that that will put us into a vise and not enable us to pursue constructive solutions to what this nation is going through. When we put something in as a constitutional amendment, it really does tie our hands for progress. And I think all of us would agree that we need to be investing in this country, not just focusing on the deficit, because if we do that, then I think we'll continue to go downhill. So when in terms of the investments, we're talking about things like the infrastructure, we're talking about investment in education, research and development, and other opportunities to really move this country forward and not constrain us and keep us from doing that, which I think a constitutional amendment to balance the budget would do.
Do you favor a national plan to place all medical records into a single computerized database? Yes or no? It's number 11.
Thank you. No. I am very concerned about the need to protect individual privacy, and I am concerned that a database of this nature may jeopardize that privacy. I have been in briefings where experts were discussing the tens of millions of dollars that have been stolen out of bank accounts through cyber crimes. The privacy of health records in a single database would be subject to the same vulnerabilities.
By the way, those are written responses that Congressman Posey drafted, and Amber is reading those to you. And she's doing a very good job.
Next question, number 17. The private practice of medicine, whether in small group setting or in larger networks, has long provided medical care to the majority of Americans. Yet it seems to be under assault from both federal mandates as well as from insurance companies and other agencies. Do you agree with that statement, yes or no? And what specific steps and/or recommendations would you take and make to begin to remedy the situation and relieve the pressure currently coming to bear on practicing physicians?
Yes, I would agree with that statement. I think that the practice of medicine is hard enough, and with over-regulation, with federal regulations, we need tort reform in lots of states. There's all kinds of problems trying to run a small business, and you know, setting minimum standards. But I would agree that it's hard to do that. Specifically, I would say that we need to look at tort reform and trying to reduce some of the overregulation that is currently on the books.
Why couldn't I have gotten that question?
At the end, we'll give the opportunity, if you have a question that you specifically would like to render your opinion on.
In addition, you all have a copy of the questions. You can all post them on the websites with your responses so that everyone can compare the responses. That would be another way of being able to do this.
I was just kidding, by the way.
Well, I always have an answer for everything. 10. Given the increasing complexities of medical care, do you believe that consumers can make informed, rational decisions in a free market context? Yes or no? State your reason.
Well, absolutely, and I think that's a big part of what this debate is about. Do we repeal this plan and replace it with a more market-oriented plan that really empowers the consumer, or do we keep it in place and empower the federal government and bureaucracies? Now, my own personal experience is that patients are very, very good at deciding what they need, and actually, one of the key reforms that I would like to see the Obama healthcare bill replaced with is an expanded tax treatment for medical savings accounts so that individual citizens can accumulate wealth in a private account and have a high deductible policy. And now the reason I feel so strongly about that is I already have many patients in my practice who have these medical savings accounts, and people ask great questions when they're actually spending their own money. And it's called market forces, and it works really well throughout our economy, and it actually works very well in healthcare. They will ask questions like, that drug is kind of expensive, is there a cheaper generic drug that you can put me on? Or I just had a chest x-ray 3 months ago, do I really need another chest x-ray? And one of the fundamental problems with healthcare delivery in the United States that we've had ever since World War II is the perverse impact of the third-party payer system, where neither the consumer nor the provider is really genuinely really concerned about the cost. And so I think people are great at figuring out what they need, and they're certainly much better than bureaucracy. And if we go to a single payer, what we will get is what they have in all these countries, which is waiting lists. That's the solution that democratic governments have chosen to pursue. So the politicians don't ever have to vote to say that nobody who's 80 years old will get such and such a procedure. They just use waiting lists. And that's the direction we're heading in.
Next question. Number 13. Given the laws, rules, and regulations of the income tax, given that the laws, rules, and regulations of the income tax require 74,000 pages, would you favor the repeal of the federal income tax? If yes, with what would you replace it? Yes or no? And what's your reason?
I wouldn't know in terms of a repeal, but I do believe that we need major tax reform in terms of the significance of our tax challenges right now in the United States. It definitely needs to be modernized, and I think that we need to do a comprehensive assessment of the tax program that we have in the United States to the point that it does enable us to have a fairer approach to taxes, and also really attacks the issues that we have right now with regard to fairness. So to answer you, I wouldn't repeal it, but I certainly would reform it because I believe that the country can handle incremental change, but not major change all at once.
Question number 5. Given that Medicaid is busting the budgets of more than one state, would you favor replacing yes or no, please?
Yes. I support giving states greater flexibility over running their Medicaid programs and have supported Florida's request for Medicaid waivers.
Some duplicates, sorry. Number 4. Given that economists predict that Medicare alone will bankrupt America, would you favor replacing it? Yes or no? And state the reason.
Would you repeat that again?
Given that economists predict that Medicare alone will bankrupt America, would you favor replacing it? Yes or no? And state your reason. Number 4.
No, I would not favor replacing Medicare. Replace it with what? You know, you go through all of your life, and then you finally get on Medicare, and you find that it works pretty doggone good. The Heritage Foundation cites its Medicare costs of $549 billion in 2011, and then 2 paragraphs later in its report, it says that if you exclude the wealthy from Medicare, that you could save approximately $5 billion. Well, you do the math, that's 1%. So their whole thrust in the report is that the wealthy shouldn't get Medicare when they've paid in for their whole life and paid in at the highest rate. And that's not fair. You know, Medicare and Social Security is kind of like a Ponzi scheme, because we're paying for folks that are using it now. And so we pay Medicare, and the people that are using it are using it. When we reach 65, then we start to use it, And perhaps we're not paying in, but we did for many, many years. So to say, I'm sorry, you're making too much money, you can't have Medicare, first of all, it's not going to solve the problem. And it's kind of a smoke and mirrors type thing. Medicare works pretty darn good. If you're on it, you know that it does. And so I'm not in favor of getting rid of it. Thank you.
Number 18. We hear that some proposals for increasing health care coverage include expanding the Medicaid system. Do you agree with that approach, yes or no? Or what suggestions would you have to fix the system?
Well, one of the programs that I advocated to try to address the needs of the uninsured, the poor, is expanding community health clinics. And these exist in many counties throughout the nation, and they've really been shown to be a much more efficient way of providing health care in terms of saving tax dollars. The fundamental problem with Medicaid is just the cost and how do you fund it, and it's a very unique program in the sense that it's shared cost between the states and the federal government, and it's putting, as it has grown, and it's particularly grown tremendously during this recession because people are unemployed, so they get pushed into the poverty range, and then they end up in Medicaid, and it's creating much, much more of a demand for Medicaid services. One of the other things that's really interesting about Medicaid that most people don't realize is about 26% of Medicaid costs are actually for long-term care costs for the elderly. Yes, it goes to treat just general medical care for the poor, and a lot of it goes to treat people with chronic illnesses, but a tremendous amount of the money, 26% in the state of Florida, is actually going to cover nursing home care. And to me, there should be a different way to do that because it's really something very different when most people think about addressing the healthcare needs of the poor. Now, I would favor expanding these community health clinics. They're much more efficient at providing care at a lower cost. Most of them are established as charity institutions so they can accept funds from corporations and donations, tax-deductible donations from individuals. And generally speaking, my experience with them, and I've volunteered in them, the quality is quite good.
Thank you. Number 19, simply for current policy allows hospital systems to receive an offset, which currently amounts to at least 30% higher for hospital-employed physicians and doctors than those charges submitted by private practice physicians. Yet many hospitals are buying practices without the concomitant overhead for which this offset was designed. This increases Medicare spending at a time when the federal government is talking about reducing Medicare spending. 3 questions. Why isn't this arrangement better known? How can this be considered responsible stewardship of taxpayer funds? And do you agree that this gives an unfair advantage to hospital-based systems versus private practices?
Well, the first part of the question, which is why isn't this arrangement better known, and I agree with you. I think this was part of the education that we were receiving with the question itself. I believe there needs to be more education of the public with regard to this distinction, because I really don't know that everybody is aware of the fact that hospital care differs from private sector care in that regard as it relates to the administrative over the cost and so forth. How can this be considered responsible stewardship of taxpayer funds? I agree with the person that asked this question. It's certainly something that I believe that we need to look at to provide more equity and fairness, particularly to those that are providing the care, the physicians that are providing the care, as well as save our funds, because I think if we looked at the administrative cost and per hospital administered care relative to private physicians, I believe that we would probably discover some fairness issues as well as some possibilities for savings. Do we agree that this gives an unfair advantage to the hospital-based systems versus private practices? Yes, I do agree that that gives an unfair advantage to hospital-based systems relative to private practitioners.
is repealed, would you favor a single federal comprehensive system of medical delivery, assuming that individual states could opt out? Yes or no, instead of please?
No, and the reason is I believe the states are in the best position to lead healthcare reform. Certainly there are some things that can be done at the federal level, such as tax deductibility of health insurance, but any details really should be done at a state level.
Number 2, do you agree with Mr. Romney's position that should the Affordable Health Care Act be repealed, that some elements of it nevertheless should be retained? Yes or no, to state your reason.
Yes, and I think I've already answered this question. Number 1, no, I do. I think that there are some good portions of the Affordable Care Act, and if it should be repealed, I would certainly hope that those elements are put into any program that would be put forth by the Congress. And you know, the other party, the Republicans, have had 2 years to come up with a plan, and not knowing whether the Affordable Care Act is going to be repealed or not repealed, they've had 2 years to come up with an alternative plan, and I've still not heard it. So, yeah, I think that if it is repealed, then I think that some of the good portions of that plan should be incorporated into whatever else is put forth. But I wouldn't want to go back to square one. I wouldn't want to go back to where we started this process and not have anything in place for those folks that have pre-existing conditions. That's it.
Number 8, currently medical care amounts for approximately 17% of the gross domestic product. Do you believe that there should be an upper limit, and if so, why? Yes, no.
Interesting question. We spend more on our cars and transportation than we spend on healthcare. And if you're going to place a limit on it, who is going to place the limit on it? And how does that limit get enforced? I thought we were the land of the free, and if you're going to have freedom, then Americans are going to be free to spend what they want on healthcare. Now, people will frequently point to that number and say, oh, that's terrible. It's not like we've gotten nothing in return for that money. Let's think about it, and let's talk about it a little bit. Life expectancy when they created Social Security in 1935 or 36 was less than 65 years. By the time Medicare was created, it was 70, and now average life expectancies are 80. Yes, we spend more of our gross national product on health care, but we now live to be 80 years old. So, and might I also add, there's a lot less pain and suffering and disability. You know, lots of people with bad hips get hip replacement surgery and they're able to walk and they have less pain. So it's not just a life expectancy issue, it's also a quality of life issue. And so I believe quite strongly that we are getting a very good product, and we spend much more on housing, and I believe we spend more on transportation than we spend on our cars, gasoline, when you add all of it up, than we spend on health care. And so let's let the market decide, and certainly I don't want the federal government deciding that we're spending too much money on health care, because what will happen then, as we all know, is you will get denials of service coming from your friends in Washington.
Number 16, do you favor laws implementing filial responsibility as currently the case in 26 states? Yes or no? To state your reason.
No, I do not. And the reason being that I think that given the challenges that we're having with healthcare right now, to pass the responsibility on to the adult children of those that are having challenges, I think, would be just exacerbating the current problems that we have with the cost of health care. I do believe that given this, that we need to go back to the comprehensive health reform solutions that we've talked about with regard to what we've started with affordable health care, and then we continue on to make major reforms in the American system that we have. So the answer is no.
Number 7, do you agree with Governor Scott's decision not to implement a state-based exchange for affordable health care? Yes or no?
Yes. The problem with the state exchanges that were included in Obamacare is that they have to abide by all the mandates set forth by the Federal Department of Health and Human Services. I believe that individuals should have choices, not simply a choice among plans that the federal government defines.
Number 14, to promote informed and logical selections by consumers in the free market for medical care, American needs an educated populace. Do you believe that federal funding for primary and secondary education has been successful? If no, will you favor abolishing all such funding, leaving the matter to the individual states? Yes or no, and what's your reason?
No. I don't think that federal funding for primary and secondary education has been very successful, and all you have to do is look at the report cards for the schools, and I would favor abolishing the funding, and I would leave the matter to the individual states. I think they're in a better position, and they know what to teach. I would hope that the schools would start teaching a little more about civics too. So.
Last question. Currently, the Congress is dominated by lawyer politicians. Would you support a constitutional amendment prohibiting any member of a state bar within the previous 3 years from serving in Congress? Yes or no? Last but not least.
Yeah, that's a great question. I love that question. I think it was Shakespeare who said, "Kill all the lawyers." Well, though my heart is with you, I would be opposed to any such restrictions, though it is somewhat of a conflict of interest to have somebody who is a professional in the field of the law writing the laws and then exiting Congress or the state legislature and going back to practicing. But I think it should be open to everybody and anybody. And having served in the US House for 14 years, we had nurses and teachers and businessmen. But yes, we had too many lawyers, and it was very interesting when the tort reform issue would come up, for example. The businessmen would all line up in support of tort reform. They all know the high costs of lawsuits in this country, and then all the lawyers would line up on the opposite side of that issue. No, I would not support such a restriction. I'm a big fan of freedom in all of its forms, and I think anybody in any profession, if they meet the constitutional requirements, should be able to serve in the Congress of the United States. But it's a great idea.
Thank you very much.
I understand that there's many taxes in this Obama bill that are non-medical. Could you share some of your views on that? One of them is, I understand that there is a 2.3% excise tax on medical devices. What is your position on this new tax?
Excuse me, I'd like you to, everyone to state your name, and also if you can direct your questions to one of the candidates, that would be easier.
Bob Johnson.
Who do you want to answer that?
Which candidate?
Okay, I'd like to, Mr. Gillmor. I understand there will be a 2.3% excise tax on medical devices. What is your position on this new tax?
Well, it's got to get paid for. If you're going to institute the bill, you've got to pay for it. I don't really have, you know, that's something that I'd really have to research to see whether that would be something that I'd support or not. I have to tell you, I've not read all 2,700 pages of the bill, so I really can't really comment, except that it's going to have to get paid for. The bill is going to have to get paid for, and there's going to have to be taxes, and so there you go.
Okay, just stand up and give your name. Did you want to ask her? No, I don't know. All right, stand up, give your name, and if you would like to direct it to one of the candidates or all.
I'm Joan Johnson, and my husband Bob and I are of an age where we're both now on Medicare. I less time than he. Make sure you all know. I have an observation, and that is Medicare is a wonderful thing, and it pays for all kinds of things. And we carry our secondary, which is Blue Cross Blue Shield, and that's fine too. And we're still paying at the same rate on Blue Cross Blue Shield, which is fine. The issue is Blue Cross Blue Shield's hardly paying anything in terms of what's left over them to pay after Medicare pays their part. And it seems to me that maybe a consideration when you all get to Congress might be reversing that. And since we're paying the same rate for Blue Cross, why not make them primary and make the Medicare the secondary to pick up the smaller amount and save some money? Because I don't see the Blue Cross going down. Just a thought.
Is there somebody you wanted to respond to them?
No, but David, if you'd like to, be great.
If your Blue Cross Blue Shield were your primary, the premium that you're paying would not be enough to cover the costs.
It's the same flat premium, though, that everybody else is paying. That's, you know, we're under a federal program, so it's the same premium as the workers and non-workers.
Yeah, it's just once you turn 65, your utilization rate of healthcare services starts going through the roof. And so if it were a real market and you were really being asked to pay it, your premium would go up. If I could elaborate on that a little bit further, you know, I was saying earlier that, you know, living to be 80 is great, and it really is, and having less disability is great. But it is the big cost driver, particularly in Medicare. And Medicare is completely insolvent. If you tried to write a health care plan for senior citizens in the private sector based on the funding scheme that currently sustains Medicare, you would be arrested by federal officials and thrown in jail for fraud. So it's only politicians who can engage in such fraud and get away with it and not be thrown in jail. So the need for fundamental reform is huge, and the one solution that's on the table, which is starting to be embraced by some of the Democrats, Ron Wyden in particular, a senator from Oregon, is the concept of premium support, which gets a little bit of the issue of means testing, and it really would interject, you know, some rationality in terms of cost and funding. And by the way, the average senior citizen in America takes out about double in benefits than what they paid in during their lifetime in the Medicare plan. And by the way, if I could add one more thing, I was told not to talk about this subject by Republican consultants, because if you really talk about Medicare and how bad it is, you lose votes. And so there's a reason nobody wants to talk about it. You talk about it, you ain't gonna get elected. Pardon my grammar. any English teachers in this room?
Do we have more questions?
Yes. Gentleman seated for two. Oh, I don't know that I need this, so I think I can project.
You do. You need it. Close to your mouth.
Close to your mouth.
Okay. I want to know, I heard that the Senate has a wonderful health care plan. And I want to know why it isn't available to the rest of us citizens. Can you explain that?
Well, you know, I'm running for the Senate, but I've never served in the Senate. I served in the House, and the House plan was the Government Employees Health Benefits Plan, FEHBP. It was the exact same plan. I know Bob Johnson here is a retired federal employee. He had the same health plan I had. The only additional benefit members of the House and the Senate get is there's a clinic in the building that's run by the Navy, and if you get sick, you can go to that clinic. But there's really not much more available now. It's not. Also, the retirement, let me just say, you heard about the cushy retirement. That was done away with in 1986 when I served in the House. Every month, I got 5 or 10 letters denouncing me for the cushy retirement that I got. And it was done away with in 1986. So the members of the House and the Senate are in the same retirement system as the park police, basically, in terms of its benefits, which is still a very generous benefit. And by the way, the federal employees' retirement system is also completely unsustainable. I hate to be saying all this to you all, but it's Social Security, Medicare, Medicaid, and the federal employees are some of the 4 biggest budget busters of the federal government, running huge amounts of red ink, and dealing with these problems is going to be very, very difficult, but they're going to have to be dealt with.
I just want, as a retired federal employee as well, I do think there are some aspects of the federal system that are applicable to the public, and that's the reason I think the thing that we do have that I believe the public would like is choice. I mean, we have, as we know, several options for our health care. I think that would be something that would be helpful to seniors. And also, that would include the public option. This is where I think that we would start towards something that would be fair for all. It would also probably drive down cost if we had a public option added to our healthcare system.
Thank you.
I've heard that the Medicare Advantage plans will be cut from the Medicare program should this, if the bill is in effect. And I'm a proud member of one of those Advantage plans, and their premise is to keep the people well, and that cuts down costs. And for instance, sponsoring gym memberships. I'm a proud member of a Silver Sneakers gym class, and it keeps us moving. And so I think that's a good benefit also. Keep the older people moving, because I'm 3 years over the limit. So, and I want to ask number 3, please. Number 3, please. And I'm Irene Bush.
Oh, hi, Irene. So in terms of the question itself, you would be asking if I want to make sure I got the question itself, Irene. Do you mind repeating the question? And I can hear it from here.
Okay, I'm just wondering, would you be in favor of cutting out those Advantage plans?
Well, I think anything, as you point out, I think the affordable health care provides resources to help us with health care, improving health care. In other words, emphasizing the prevention aspects of it so that we are keeping healthy. That's the reason I think with regard to the Advantage plan, again, I have to make sure that I'm understanding the new proposals, but I do know that affordable health care, one of the provisions is to put an emphasis on health care prevention, and this not preventing the health care itself, but enabling us to have good health so that we don't have to incur costs later on in life that's because we don't get care. The other thing that it does is enable a broader spectrum of the American public to get that care. So as far as the Advantage Plan, I'd probably turn to Dave to answer the aspects of that, if you don't mind.
The Advantage plans are great in that, you know, they offer expanded benefits, and so you can get, you know, eyeglasses and gym memberships and things like that. They've come under intense criticism, though, because they were originally proposed as a way to reduce costs through making people more healthy and more active, and they were shown ultimately in the end not to reduce costs. And so because of that, and I think it's really more because it was a Republican idea, it has been a target for reduction, and specifically the Medicare Advantage plans are cut very, very significantly in the Affordable Care Act. And so in a few years, the Medicare Advantage plans are mostly going to go away. There's just not going to be the dollars behind them. It was a good idea when we voted them in place. I don't know, Richard is in the health insurance business. He might have some more to add on this, but they've already been cut, and they've been a target for cutting because they basically didn't save money. But they're great.
The Advantage Plan, I'm on the same one, basically, Irene. It's a great plan, so is my wife, Judy. And it takes monies from the government, and it really expands the choices that you have as far as staying healthy and getting out and moving. And the gym membership, I've got silver sneakers too, so don't use them as often as I should, but I'm already a gym member somewhere else. So, but yeah, I don't want to see them go away. That's one of the things I'd change in the Affordable Care Act is I think it would alter that trajectory so that part of the affordable care would go away and would be able to keep our Advantage plans.
We have one last question.
Yes, there's my name is Ed LaRue. There is a plan for the Senate to reform Medicare by replacing it with what is called the Congressional Health Care for Seniors Act. For all seniors, they would get the same health care plan as the senators and the congressmen. And it could save $1 trillion over 10 years. Why don't we replace Medicare with that plan? It's in Rand Paul's budget, which he's presented. 47 senators have signed on.
That's just a variation on what I was referring to previously as premium support, which is, I think, what we're ultimately going to end up adopting. It was originally denounced by the left, by the Democrats. The guy who originally proposed this was Paul Ryan, the chairman of the House Republican Budget Committee chairman. And, you know, they ran ads showing him pushing an old lady, you know, off a cliff in a wheelchair. But, you know, if you don't do this, you know, you're going to have to adopt something else, either higher charges or higher taxes or raise the retirement age. And in the premium support model, you would put all the seniors basically in at the federal employees health benefits plan, which was just spoken about, and you would choose, you know, Blue Cross or GEHA or Aetna or something like that, and then the premium would be funded by the federal government up to a certain level, and then if you wanted expanded benefits, you know, you wanted eyeglass coverage or you wanted, you know, sex change operation coverage or whatever you want. And you know, that's a mandate in Rhode Island, I think. That's why I mention it. It's kind of a crazy world we live in. But you would then pay the added premium, basically. So it's called premium support, but not where your entire premium necessarily is going to be paid by you. And I think it's a great idea. I think Rand Paul's budget is actually a very good budget. We need to adopt some kind of change like that.
Thank you. Those were very thought-provoking questions as well. If you have any questions at the end, I'm sure the candidates will stay at the meeting too. But we do need to wrap up, and we are going to ask each candidate, just go down the line, to give their 3-minute conclusion so that we can now find out the end point of their healthcare ideologies.
Well, thank you all for coming out and participating in this forum. It was very educational to me, and the whole process was, I want to thank the Association of Medical Professionals for instituting this. You know, healthcare takes up 1/6 of our gross national product, and that's too much. We've got to control costs, because otherwise it really doesn't matter what we do, it's going to continue to spiral out of control. So that's something that we're going to have to work really hard on, and I'm going to ask that when I get to Washington that you all will keep me up to date on solutions that you might come up with. I'm running on a process, I'm running as an independent because I believe we need an independent voice in Washington. One that doesn't owe allegiance to a party or a political pack. And I have running on a platform of term limits. I will serve only 2 terms. That's 4 years, and then I'm out of here. That's what we need. And the only way we're going to get term limits is by electing candidates like myself who promise to only serve a short period of time. Because it's gotten to a point where we're just out of control in Washington. And so remember, you know, we're looking forward to the primary election in only 2 weeks. And so all our focus is on the primary election 2 weeks away. But remember, this November, vote for Gillmor, the independent voice in Washington. Thank you so much.
Well, Richard Gillmor and Shannon Roberts, Shannon, are running for the US House to challenge Amber's boss. I'm running for the Senate, and as I understand it, the other Senate candidates were invited and they didn't come. So I will just really just close out talking about healthcare and where I think we need to be going as a nation in the future. Obviously, that's an issue of paramount concern to me as a physician. I practice medicine in this area. Half of my patients are Medicare patients. The solvency of Medicare is essential not only for the welfare of my patients who rely on it and depend on it, but it's also essential for my livelihood. If Medicare is bankrupt, not only do my patients have difficulty gaining access to medical care, but then I have a problem basically running my practice and paying my nurse and paying the bills to keep my office operating. I think the reform path that we are going down, which is more Washington, more bureaucracy, less freedom, more decisions being made far away, is a very, very dangerous and a very bad path. And there are a whole host of provisions in this bill, the Obama health care bill, that are going to actually have a very, very negative impact and will increase costs and not reduce costs, and will decrease access, not expand your access. Two of the features in this bill, guaranteed issue and community rating, have been tried in many states, and where they have implemented it, costs have gone up. Now, there are a few things in this bill that I think are worth keeping. The working poor who cannot afford health insurance, there's a provision in there for a tax credit so that they can purchase health insurance. I think that's a great idea. There's a couple of other things in the bill that I think are good, but most of it is really bad. What we fundamentally need is insurance reform. We need individuals in the individual market to be able to purchase health insurance with pre-tax dollars, just like corporations are able to do. We need to have a real marketplace for health insurance where people can purchase health insurance to tailor to their needs, rather than a health insurance plan that has a whole bunch of mandates in it. And I really believe if we want to bend the cost curve, as the bureaucrats in Washington like to say, and the politicians. In other words, get costs down. We really need market-driven forces, and the medical savings account is the best thing for achieving that goal. We can do all these things. We can get the uninsured better access to care. We can lower costs, but we don't do it through committees and unelected officials in Washington, D.C. making those decisions. We need more freedom and liberty, and that is not what this bill does. I want to go to the United States Senate for more freedom and more liberty for you, the people. Thank you very much, and I want to thank the hosts for putting this event together. Thank you very much.
I think if we went back to the free enterprise, free choice approach that you're talking about, that's one of the reasons that we've gotten into some of the problems that we have now. I do think we need to have major healthcare reforms so that we can anticipate the cost as well as provide for those that are uninsured right now. I opened the comments with the fact that 45,000 of our American citizens die each year because they don't have health insurance. Right here in Indian River County, 20% of the children and 33% of our adults have no health insurance. So when we talk about the affordable health care, if we repealed it, for example, we'd have 224,000 young adults who gained coverage that wouldn't be insured, 250,000 seniors in Florida that wouldn't have the rebate because of the donut hole and so forth. The United States, right now, out of 33 developed countries, the U.S. is the only one that doesn't have universal health care. We ranked 50th in terms of life expectancy, whereas other countries have universal health care ranked much higher. And among the medical bankruptcy filers in the late 2000s, most were well-educated, owned homes, were employed in middle-class occupations, and 3/4 had health insurance. So we leave ourselves very vulnerable if we don't do major health reform in this country. I think the Affordability Health Care Act was a major step in the right direction, but we need to take further reform. And you're going to need a leader in Washington representing us from this district that knows how to work across the aisle. I've certainly had major federal experience in this regard to work with our congressional colleagues to continue the path towards progress and not take us backwards towards our failures of the past. So I ask you certainly for your support. Again, Shannon Roberts, running for Congressional District 8, and I ask you to help us move forward, not backwards.
Thank you so much to the Association of Medical Professionals for providing this candidate forum and this opportunity to discuss the important issue of healthcare. The most important issue facing us right now is defeating Obamacare, and it will interfere with the doctor-patient relationship. The driving principles in any new healthcare reform should be personal responsibility and individual liberties. I have a proven record of standing up for you in Washington and will continue to fight for jobs, fiscal accountability, and responsibility. Thank you for coming out tonight, and I look forward to earning your vote in November. God bless you, and God bless America.
I don't know about you, but I enjoyed this evening, and I learned some new things speaking here from each of the candidates and the representatives. I'd like to give them a round of applause.